Hello, I'm Dr. Khandalavala, board certified in obstetrics and gynecology. You are now at 24 weeks in your pregnancy. You may be noticing quite a few changes in your body. Your baby's gained about 1/4 pound since your last visit and is filling out quite a bit. Some of the things you may start to see during this stage of the pregnancy are tightening of the uterus that are usually non-painful. These are called Braxton Hicks contractions. They're normal if they're occurring 3 to 6 times an hour. If, however, they start to occur more than 6 times an hour, please call the office or after hours the doctor on call. Any vaginal bleeding that is bright red in color or gushing of fluid from the vagina at this stage of the pregnancy should be evaluated in the office in the daytime and in labor and delivery after hours. Remember, painful contractions of the uterus are not Braxton Hicks contractions and represent preterm labor. And this is a serious condition at 24 weeks because the baby is still very early and should be evaluated in labor and delivery. You may be wondering, what does my baby look like at 24 weeks? Your baby's about 1 foot long and weighs about 1.5 pounds. The lungs are reaching their final stages of development, but they're still far from done. What can you expect at your visit at 24 weeks? A weight check and a urine check and a blood pressure check, all of which are tested for any abnormalities. We will also measure the uterine height and the baby's heartbeat, following which we will counsel you on the things to watch for preterm labor. Things like Braxton Hicks contractions, vaginal bleeding, and leaking fluid from the vagina, and the importance of these symptoms will be addressed. You will then go home with a bottle of orange liquid, which is the glucose solution that we will instruct you to drink 30 minutes before your next visit, at which time you will be screened for gestational diabetes 4 weeks from today.